So, next topic is upper GI bleed. It's V46, again a very high yield topic, and I think I should compare the upper GI bleed as well as the lower GI bleed we did previously. So, in this scenario, a 73-year-old man presents in ED with severe bleeding per rectum and a hemoglobin of 7. After initial gestation, a colonoscopy was negative. He had another rectal bleed on the ward overnight. How will you manage him? So up to 15% of the patient with rectal bleed have a source of bleed in upper GI, esophagus, stomach and duodenum. Therefore, if no lower GI source is found, he needs another urgent OGD. All patients with upper GI bleed should be managed in accordance with the World Society of Emergency guidelines. That patient be assessed by ABCDE approach. And we should sustain them with oxygen, wide bore intravenous access, Hartmann's fluid, check blood, coagulation, clotting, savant group, cross match, repeat FBC and UNEs. And they also recommend, the World Society of Emergency Surgery also recommend to maintain the blood pressure systolic 90 to 100 and until hemostasis is achieved, and normalization of the lactate and base deficit and hemoglobin 7 to 9. And correct the coagulopathy. I would review history and examine the patient, paying particular attention in the use of NSAIDs, anticoagulants, history of peptic ulcer disease and indigestion, alcohol intake, signs of chronic liver disease, and assess the observation chart to look for hypotension and tachycardia and tachypnea. You arrange an urgent OGD which shows a bleeding gastric ulcer. How can you control the bleeding? So obviously it's a gastroenterology job. They will do endoscopic treatment to achieve the hemostasis and reducing the need for surgery and mortality. In patient with bleeding peptic ulcer, the recommendation are start PPI as soon as possible and erythromycin that could be helpful. All actual bleeding sources, visible vessels and ulcer with adherent clot should be treated with dual modality endoscopic therapy. Over the scope clips and hemostatic powders are available in addition to conventional hemostatic modalities. And there is also recommendation that administration of high dose PPI is continued in FAN for first 72 hours after successful endoscopic hemostasis, and repeat endoscopy should be considered in those patients with a high risk of rebleeding. Are you aware of any scoring system to assess the risk in these patients? Yes, the Rockall scoring system. Rockall is based on the age, degree of shock, comorbidity, endoscopic diagnosis, and presence of major stigmata of recent hemorrhage. There are 3 levels: high, very low risk and high risk. Very low risk safe for outpatient management, and low risk you need administration and early endoscopy, and high risk for need for resuscitation and urgent endoscopy. Patient with initial Rockall score of 1 or more than 1 should be considered for an early upper GI endoscopy. What are your treatment options if patient has a significant rebleed after the initial endoscopy? So again, repeat endoscopy, celiac and mesenteric angiogram with radiological arterial embolization. In order to visualize the source of bleeding, the rate of bleeding should be at least 1 mil per minute. It was also mentioned in the rectal bleed. In the absence of active bleeding during angiography, neither prophylactic embolization nor provocation within the use of anticoagulants are established standards of care. Surgery: underrunning of the vessel, typically gastroduodenal artery, on the posterior wall of the first part of duodenum. Discontinue management of if the source of bleeding is found to be esophageal varices. Again, resuscitation, pre-endoscopic treatment with the telepressin, endoscopic therapy with variceal band or cyanoacrylate injection. Failure to control variceal bleeding needs tamponade by temporary balloon followed by TIPS, transjugular intrahepatic portosystemic shunt. Esophageal transection is becoming a historical surgical operation for the treatment of bleeding esophageal varices, as this is so rarely performed nowadays that few surgeons can have the experience. Thank you.